Hello and welcome. My name is Muhammad Ali Raza. I'm one of the chief residents at Connemara Memorial Hospital in Pennsylvania. So today I will be discussing 12 red flag signs in patients with any kind of headache. So I have made a mnemonic to memorize those 12 red flag signs. So the mnemonic to remember those 12 red flag signs is fascist Pakistan's People's Party parliamentarians is a red flag. So how do we further explain that? So fascist stand for, let me go one by one through the each feature, each red flag sign that we have to see when any patient with headache comes to you for evaluation. So F stands for any focal deficit that includes any decreased consciousness level. The focal deficits include any weakness, any numbness or tingling. So you need to be worried about any stroke or space occupying lesions in this case, and you need to get the brain imaging like CAT scan, CT scan, or brain MRI. A stands for age more than 50 years old. So patients who are old aged, they are at risk of more serious underlying etiology. So we need to be cognizant about that. S of Fascia stand for systemic symptoms, including any fever. So if patient has headache and fever, so you need to be worried about any neuro infections that include any meningitis, any encephalitis, or any CNS abscess. Okay, C stands for any cancer history. So there are like certain cancers in our body that can metastasize to the brain. So we need to be very vigilant, especially about the lung cancer, about the breast cancer, and malignant melanoma. Okay. Immunodeficiency, I for immunodeficiency like HIV. So patients with HIV can develop headache too. So we need to look for any opportunistic infections like toxoplasmosis. Also, we need to look for any patient, these patients can have CNS lymphoma. S stands for sudden onset and maximal intensity within 1 minute. This is very important feature of an headache, any headache that presents to you. Okay, so this is called a thunderclap headache. So what are the top differentials of thunderclap headache? That include subarachnoid hemorrhage, cervical artery dissection, stroke, hypertensive crisis, reversible cerebral vasoconstriction syndrome. So you don't need to wait for anything. First of all, you have to have immediate CT head for these patients. So if the immediate CT head rules out subarachnoid hemorrhage, but you still have high suspicion for subarachnoid hemorrhage, you need to do the lumbar puncture LP of this patient. So what are you looking in LP of this patient? For subarachnoid hemorrhage, you are looking for xanthochromia. Xanthochromia is like RBCs are more than 10,000 in CSF of a patient. While the patient with reversible cerebral vasoconstriction syndrome can present with thunderclap headache, but those patients don't have any xanthochromia. So even afterwards, you can still get the advanced imaging like MRI. And if patient has subarachnoid hemorrhage, one thing you must keep in your mind that you have to consult neurosurgery urgently, because if there are any aneurysm that can be taken care of by neurosurgery. Okay, so what does T stands for? T stands for trauma. So the trauma patient can present with headache from multiple causes. The trauma can lead to intraparenchymal hemorrhages, subdural hematoma, extradural hematoma, or concussions. Everything can lead to a headache. So, and those patient needs actually imaging. So now we have to come on the other side of the mnemonic. So Pakistan stands for any postural headache. So when does the postural headache happen? So if patient is sitting down and then patient stands up from a sitting position, so those patient can develop headache. So that can be because of intracranial hypotension. So that intracranial hypotension can develop from the CSF leakage from any cause, like including lumbar puncture. So if someone has gone for lumbar puncture, the CSF can leakage and can lead to intracranial hypotension and postural headache. So first of all, the diagnosis can be made clinically, but sometimes you need MRI head with contrast, and it shows meningeal enhancement. And sometimes you need spinal MRI or CT myelogram to show exact site where the leakage is happening. So what you can do to fix that leakage, you can do the epidural blood patch at that place. Okay, and people stand for papilledema. So papilledema, as you can see in the picture, the disc has very blurred margins, and along with that, disc is elevated too, and the vessels are tortuous at the disc margin. So these are all signs of papilledema when you look at patient's retina. So papilledema is a sign of increased intracranial pressure, like in certain disorders. Uh, so you have to look for further history. There are certain causes of papilledema or increased intracranial pressure, like it can happen in the patient with cerebral venous thrombosis. So you have to look for the risk history of pregnancy or OCP's use. It can happen in patient with benign intracranial hypertension, idiopathic intracranial hypertension. So you have to look in obese women. Our patient have increased vitamin A level, our patient is using tetracycline, patient is on steroids. So you have to look for these risk factors to rule out idiopathic intracranial hypertension. And also papilledema can be caused by the space occupying lesions. So you have to look for any focal neurological deficits in those patients. So the next feature from party precipitated by sneezing and coughing also goes with increased intracranial pressure. So like the same causes which we discussed for papilledema also goes with this feature, like cerebral venous thrombosis, idiopathic intracranial hypertension, and space occupying lesions. So parliamentarians, like pregnancy and puerperium. Puerperium is the immediate post-delivery period. So what happens in pregnancy and puerperium? There's like increased estrogen. So like there are certain things, especially in the pregnancy and puerperium, in the third trimester of pregnancy, there are certain condition like hypertensive condition, like if patient has preeclampsia, you need to consider that headache in that time. So you also need to consider cerebral venous thrombosis is also higher in pregnancy, and pituitary apoplexy can happen in pregnancy. And the next thing that you can, because if this patient with pregnancy, when they have delivery, they can get the epidural injection, so they can have CSF leakage too, they can get postural headaches too, and they can have intracranial hypotension. So the last thing that we need to keep in mind is autonomic features. Like you can see in this patient, there is some ptosis and meiosis. So there are certain kind of headaches that can lead to those autonomic features. The most common one is cluster headache. So this is a summary of the red flag features in any patients who presents to the headache. I will just like go through it quickly. So fasciist F stands for focal deficit. So you'll need to look for any stroke or space occupying lesions. Age more than 50 years old. They can have anything. Systemic symptoms like fever. You have to look for neuroinfections, cancer history, especially the malignant melanoma, lung and breast cancer, immunodeficiency, HIV. So there are certain opportunistic infection in the brain, and CNS lymphoma. You have to look sudden onset and maximal in 1 minute is a thunderclap headache that you need to pay particular attention to. Trauma can cause multitude of problems. On the other hand, if we go to Pakistan's People's Party parliamentarian, Pakistan stands for postural headache, and that can be caused by the intracranial hypotension, while papilledema and precipitation with sneezing and coughing can be caused by the intracranial hypertension, like raised ICP from different causes. Pregnancy and puerperium can lead to different kinds of headache, like that I already explained, and autonomic features are one of the features of cluster headache. Thank you guys. I highly appreciate your time, and if you have any questions, please let me know.